Namaste everyone, welcome to Short Hours, where young mind meet the real professionals. And today, we are going to talk about the world that carries us every single day. And most of us don't even appreciate it. I'm talking about your knees. Yes, those bony hinges that crack, creak, and silently complain when you sit in a leg crossed position for too long or climb the stairs. But this episode isn't just about pain. It's about precision, it's about power, and the fantastic science behind it. And today, the someone who's joining us hasn't just seen the inside of a knee, but also rebuilt thousands of them. He's trained across Pune, Mumbai, Germany, and Australia. Yes, he's got more degrees than a pair of sneakers. And today, we are going to talk about from ACL tears to knee pain to yoga posture fails. So, if you're a student who's bored of watching those 6-hour long lectures or someone whose knees sound like a bubble wrap, this video is for you. Grab your headphones, sit relaxed and watch.
Every legend begins with one step. He studied not just medicine, but every fracture of the human spirit. From sports to the quiet classrooms of Helix, to the high-stakes theaters of trauma. These experiences and learning from the best minds in India and around the world have shaped his practice. He brings this knowledge-7 expertise back to his home country, India, and serves his patients, aiming to offer the best, the latest, evidence-based care in orthopedics with compassion and integrity. He is none other than Dr. Raunak Dhawale, a consultant orthopedic trauma, robotic joint replacement, sports medicine and arthroscopy surgeon.
Please welcome Dr. Raunak Dhawale. He is an orthopedic surgeon, a trauma hero, a robotic joint wizard, the only surgeon in the Vidarbha performing calipered kinematic knee replacement and anterior hip surgery. Just some next-gen knee stuff. So doctor, let's just rip the bandage off. Why is it that even 20-year-old somethings are now dealing with knee pain? Aren't we supposed to get old later?
So the answer to this question is quite a long one. Before I answer to this question of yours, I'll just take our audience through the structure of a knee joint. So more or less, that's how your knee joint looks. Okay. So this is your femur bone, that's your tibia, that's your fibula. This is basically the thigh bone and that's the leg bone. That's your patella, or like you say it in Hindi, ghutne ki vati hai. Okay. Now when you look inside this knee joint, you will find this particular ligament that's called the anterior cruciate ligament, and one on the back side is the posterior cruciate ligament. So these two ligaments are basically inside the knee joint and they provide stability in this plane like this. Okay. Now on the outside there is a bigger ligament on the inner side or the medial side, that's the MCL, and on the outer side is the lateral collateral ligament or the LCL. Okay. So these two ligaments provide stability in this plane to the knee joint. Alright. So another thing, when you dig in deeper in the knee joint, you see this layer over here which also looks like this. Somewhere it's yellow, but here it's blue. So just to show you how it looks. Now this layer is the layer of a cartilage, because bones will rub on bones if there is no cartilage. And another extension or part of a cartilage is the meniscus, which also acts like a shock absorber for your knee. So this here is the medial meniscus, and over here is the lateral meniscus. So they are basically the shock absorbers of your knee. Now, about the knee joint is the largest articulating joint in the human body. It is also a synovial joint. It is also a hinge joint and a pivot joint. So all these are sorts of motions that happen at the knee joint. Now, when you come to the problems that are being common even in the younger age and even in the older age, there can be multiple factors. So one of them right now is less activity, having a sedentary lifestyle. You are not mobilizing enough. Obesity is another reason for having knee pain, because every kg of body weight that you have more than what you're supposed to will put in 4 kgs of more weight on each individual knee when you're walking. So imagine the pressure on your knee joint. Another thing is sports injuries, like contact sports or non-contact sports even. Athletes are having ACL injuries, they're having cartilage injuries, and so on. There can be a bad footwear if you're having flat feet and you're not wearing the footwear that you are supposed to wear. So it will directly impact on your knees. Also depends if you are not doing your knee workout or knee exercise on a good surface. That is a bad surface, like suppose you say a treadmill wherein you're running, the action reaction force and the impact on your cartilage isn't that great. Okay, so somewhere that will impact your knee cartilage and cause knee pain. There's another thing called unsupervised training, wherein you are training in the gyms on your own and you're not having any personal trainer to look after, and you're just going on doing your own exercises. Somewhere that will affect your knee, because there all the structures that I mentioned somewhere or the other will get sprained, will get stretched, okay, and you will have a knee pain, and which of course so many of the people will self-medicate and take care of the pain on their own. So that's not something you should do. If you're having a knee pain, you should consult your orthopedic surgeon.
Guilty. I've blamed everything from my gym shoes to the old floor, but it all makes sense now. But what about those teeny tiny warnings we love to ignore, like that random pain when we start walking or climbing the stairs, or when we sit in a position for too long? Should we just start panicking or stretching?
So the knee pain can come in various forms and at different ages. Obviously, if I said at your age, I'm sure you won't have something like an osteoarthritis, but you are sure, you sure might have some strain on your meniscus or on one of your ligaments, or you might have some knee effusion, which will be caused because of some minor trauma that you may or may not remember. Okay, so when you feel that you are having some pain in and around your knee that is going on for too long, you shouldn't think of just getting medicines over the counter and self-medicate yourself and try and treat it yourself. You can probably go and see the consultant, an orthopedic surgeon like me, for you at the earliest. For people who are older, for them, if they are having knee pain, we might have to be aware of the warning signs. So for people who are in their age group of about 50s or 60s, they are elderly and they are having knee pain, so they should be aware of some of the warning signs at their age. Somewhere starting with the morning stiffness, which gradually improves in about 30 minutes or 40 minutes when they start moving their knees. Another thing I would like to add is about increase in pain with activity, wherein they are mobilizing and still they are having persistent pain. That might be because they have some cartilage wear. So you see your hair will be black, and then with age they'll gray and they'll become white. So just like that, even your knees, which earlier looks like this, will go on to wear and have some changes like this. Eventually, when the osteoarthritis sets in, it will somewhere look like this. Okay, that's the worn out cartilage. So elderly people are known to have osteoarthritis because that's part and parcel of aging. So the warning signs for you will be morning stiffness, some swelling in and around the knee, noises from your knee like grinding. When the knee is grinding bone on bone, you'll have severe pain. You'll have some cracking sensation around the knee, or cracking noise rather, coming out of the knee joint. There will be reduced range of motion in your knee, and you might have something called an FFD where the knee just doesn't stretch out how it used to be. Okay, so all this for you guys is the warning signs.
Okay, let's talk ACL tears. I know it sounds like something only pro athletes get, but boom, suddenly your cousin was playing weekend cricket and ends up with a brace in just 6 weeks. So what are the causes for them, and how can we not end up googling how do I need a knee surgery after dancing at a wedding?
So if you look at ACL tears in particular, if we go back in history, there was a guy named Smith Papyrus who had described ACL back in 3000 BC, and since then human beings have been aware of the ACL injuries. Okay, so now the ACL, as we saw here, this is the ACL ligament, and this provides stability in with the PCL as well. This provides stability in this plane. Let's not get into the minute details of it, but for your knowledge, when you are playing some sort of sports, usually about 80,000 to 2.5 lakh people have ACL injuries annually in the US, and most of them, about 65 to 95% patients who either undergo bracing or either undergo some sort of surgery have good recovery rates from the ACL reconstruction, or one of the 100 ACLs heal on its own. So these injuries are quite troublesome because of the joint fluid that is present inside the knee joint. So the joint fluid will never allow the ACL to heal on its own. Now, once the ACL is broken or torn, it will never unite on its own. There will be only 1 in 100 who will heal the ACL on its own. So these injuries are most common in athletes and sports people because of the twisting injury that they are prone to. So this is the twisting motion wherein the two bundles of the ACL are torn at different levels of rotation, and that itself will give them a popping sound or sensation in the knee when the injury happens, and will probably make their life miserable for the next couple of months. Either they are put in a brace, or either they are resting with a swollen knee and they are not able to walk properly how they used to walk. They'll always complain of some sort of instability. Pair ladkharata hai is what patients say. They are not confident with their knee. That's because one of their prime supports in the knee is gone. And also because there are a few microscopic mechanoreceptors present on the knee which are responsible for the proprioception, that is the balance that your knee has when you're standing on that foot, or using that foot rather, or that limb rather. So those are gone, obviously, because your ligament is torn. So that's why, as I told you, these ligament injuries are more common in athletes, especially in younger people, because they don't train properly, they don't warm up properly. They can probably just start playing their sports, whatever sports. Everyone plays sports these days. So, if you're not supervised, if you're not playing it the right way, you're more prone to injure your knee and your ligaments inside the knee joint, the ACL.
So basically, a proper warm-up is a must, just like our mentors tell us when we are under training. Okay, doc, time for bone truth or total nonsense. It's like rapid fire edition, where I'll give you facts, or you will just tell me if those are just myths or something they made up or real truth. Are you ready?
Yes, of course.
So, do knees really crack when they're dry?
Alright, so dryness and knee cracking is altogether a different ball game, because whenever when we consider the knee, it is surrounded by a capsule around the knee joint, okay, and inside the capsule there is a layer called the synovium, which has type A and type B cells. Now the type B cells produce the synovial fluid and type A cells clear the debris, and that's how the balance is maintained. When you're not using your knee for too long, the synovial fluid content will go down in the knee joint, and that's when the knee dryness in the knee sets in. Okay, that's somewhere in routine terms we'll call the knee is dry and there is no fluid. Now, if you keep moving your knee properly, the function of your knee joint is to keep you mobile. And if you're doing that the right way, your knee, you will never have a dry knee, or the synovial fluid won't be less, except with age, wherein the type A cells are probably more in number than the type B cells, and there is less creation of the synovial fluid in the knee joint. Now, if the knee cracking, it's a normal phenomena wherein there is a release of gas bubbles inside the joint. It's basically nitrogen, oxygen, or carbon dioxide that is being released in the form of gas bubbles, and it's quite normal. It's not just the knee joint, but your other joints as well will crack like this. Okay, so that's quite normal. You don't have to be scared about it. It's very normal for that. However, if that is painful, if that noise coming out of your knee joint is causing you pain, then that might be concerning, because somewhere your meniscus, ligaments, or tendons might be involved around it.
Okay, doc, time for bone truth or total nonsense. This is rapid fire edition. So basically, I'll give you a statement and you have to tell me if it's a fact or something people made up. Are you ready?
Yes, of course.
Okay, first question. Do knees really crack because they're dry?
All right. So, cracking of the knee or noises coming from the knee joint when you are moving is because of formation and release of gas bubbles from the synovial fluid. In the synovial fluid, these are basically nitrogen, oxygen, or carbon dioxide bubbles that burst and that cause the noise, which is completely normal, and it will happen in all the synovial joints. Now, dryness of the knee might be because of the less amount of synovial fluid in the knee joint, and that if you're moving your knee quite often, that shouldn't be an issue unless you have worn out cartilage, and that's giving you some trouble.
Is surgery the only option for knee pain?
Surgery won't always be, surgery is not the only option for knee pain. However, it is one of the options for knee pain, along with conservative line of management, physiotherapy, some interventions like some injectables or steroid injections in the knee joint, or some lubrication injections in the knee joint, which we call as hyaluronic acid injections that protects the cartilage, and some physiotherapy, of course.
So, does running ruin your knees?
See, running is usually a good exercise, walking and running both for that matter. But if your knee is having some trouble that is pre-existing, like you have an existing cartilage damage when there is some osteoarthritis and you are starting to run, that will surely ruin your cartilage and cause more trouble for you. If you are overweight and you are starting high impact activities, that will ruin your knees. You have poor biomechanics of the knee joint, like in case of the alignment issues that exist in some patients. You have alignment issues in your lower limb and you're running, that will cause some trouble for you. And if you're running on hard surfaces, will surely cause more impact and pressure on your knee joint that will ruin it. However, when you're running, you can always make sure that you are doing a warm-up for your knees and stretching after the exercise is done.
Now, this is a really stupid one, but can your joints really predict the rain?
So, the joints won't tell you about the weather forecast, honestly, but sure, there are pressure changes in the atmosphere when a storm is approaching, and that will lead to the when the storm is approaching, the atmospheric pressure drops and the pressure inside the tissue will increase, which in turn will lead to increase in the pressure changes, irritate the nerves and cause some knee pain. If at all there is some so when there is a colder temperature, the muscles go stiff and there is some vasoconstriction, and that will reduce the blood flow to that area, which in turn will reduce the lubrication and increase the friction, and that's why there will be knee pain in colder temperatures. So about humidity and rain, whenever there is increased humidity, that can lead to retention of fluid in and around the joint space and lead to joint stiffness. So in case of high humidity, there will be retention in and around the joint space and will lead to joint stiffness. You can go about it by doing warm compresses to the knee joint, taking some NSAIDs, and doing a proper consult with your orthopedic surgeon.
Can diet and supplement fix your cartilage?
See, because most of it depends, a lot of your diet dictates how your knees or your other joints behave. So diets that are rich in omega-3, calcium and vitamins is quite useful for you. All these rich dietary supplements can delay the progression of osteoarthritis of your knee joint.
So, where's the line between rest, rehab, and going under the knife? When does the yoga mat stop working, and when does the scalpel enter the chat?
That's a wonderful question, Shaurya. So, basically, if I would like to put it in this way, that on yoga mats, you are doing your stretching exercises for your knee joint. If you're having knee pain, if you're doing physio, that's quite good, because if you have good quads, good glutes and good hams, like the quadriceps, hamstrings and gluteal muscles are quite good, you won't have too much pressure on your knee joint, and the muscles will take care of the pressure and your knees will function in a much better way. Scalpel, I'll always say that surgery is the last option, and the knee has to earn a surgery, and a doctor will always tell you that you need the surgery when the knees have worn out or knees really need that fixation, especially in case of ligaments. Obviously, we have to go in and put in another ligament in the place of the torn ligament, or repair your meniscus so that the progression of osteoarthritis is delayed or the cartilage doesn't damage in the long run with the torn meniscus. So there are multiple lines that will define where you need to rest. Obviously, if you have an acute injury, you need to rest. You need to do lots of ice packs, and you need to give elevation for your lower limb so that the swelling comes down. You need to take some medications for your pain, because you shouldn't soldier on with the pain for a longer duration. Self-medication is not advised, because you need to take the right pair of medications for that knee pain.
Okay, let's do a public service podcast. 1 minute, one tip. How do we protect our knees before 30?
Protecting your knees before 30. Okay, so I'll advise you to keep moving your knees. Okay, keep building strength of your hamstrings, of your quadriceps, of your gluteal muscles. You can, if you wish to, go to the gym or practice running or cycling as an exercise to keep your knees mobile and avoid the wear of your knees. See, with the age, the wear and 1 minute tip, right? With age, the knees will wear, but you can always delay the progression of the wear or a faster wear if you're exercising your knees properly.
This is a big one. We've all Googled knee pain after workout and were convinced that we need a knee transplant by this Thursday. So how do we know that which is real advice and what is just doom scrolling?
In that case, I will request our kind audience that if you're having such kind of knee pain, do not go and Google your symptoms on the internet. The internet is not feeling your pain, okay? And internet is not going to operate upon you or take care of your knees. It's just going to give you statements, or some people who tell you that they did one or the other thing when their knee was aching. What you really need to do is find a specialist consultant around you, get a consultation sooner, and not soldier on with your pain for longer, not ruin your knee with that pain, and not bear the pain for longer duration. There is a high possibility that you might get information that is fake or that is not backed by research on the internet. But a consultant who is specialized in this field will tell you details about your pain, will find the particular cause of your pain and treat it accordingly. So I advise you to find the nearest orthopedic consultant who is specialized in knee surgeries when you have the knee pain. And if you still don't find that person, or if you're still not satisfied with that opinion, you can always drop by in our clinic.
Who knew our knees were this dramatic? But thankfully, our Dr. Raunak is much more cooler than that. If this episode made you hit the gym or have a leg day or make your posture better, thankfully, this was mission accomplished. Please stay tuned for our next episode where we will explore about this surgeon's global journey and robotic surgeries and whatnot. Also, going on with real life tips for future doctors. So, that is it for today. This is Shaurya signing out. Thank you.